So looking at novel tools, at this point in time, people are working on blood tests mainly, and also some refinements of the radiology we do. But we have to really also keep in mind that some of the tests, like the radiology, we're talking about some fancy radiology to detect early. These will be probably more in patients who are high risk of developing pancreatic cancer. So the future will be to really focus on patients who we know can be at higher risk of pancreatic cancer, because otherwise you can't just work on every single individual living on this planet. So who are the patients? Obviously, as we grow older, the risk increases. But again, there are too many older patients or older individuals here. But certainly people who have a family history of pancreatic cancer. Definitely in patients who we know they carry the genes that predispose to pancreatic cancer. And the most important one, as you know, is the BRCA1 or 2 genes. Patients who have new onset diabetes, now we think that this could be a red flag for someone to develop pancreatic cancer. But at this point in time, all these attempts are pretty much still experimental. We really need more data for it. I don't want to go out and recommend to people, go and do this, do that. However, having said that, if I have a patient with BRCA1 or 2 mutation, known BRCA1 or 2 mutation. When I say patient, like an individual, let's say I'm a practitioner and someone comes to me for high blood pressure and tells me like they had a sister who had breast cancer, and the sister was tested as BRCA positive, and I test the patient, and the patient BRCA positive doesn't have any cancer yet. But that particular person who has a family history and proven genetics of BRCA in himself or herself, that patient, I will put them through a system of early detection, which will include regular scans and regular endoscopic ultrasound. So there are some minor segments of the population that we can do it now, but for the rest, it's still work in progress. And I think there will be some very interesting new markers which we can do in the blood in order to detect cancer, but how specific they will be for pancreatic cancer, these are things that have to be worked on. Because the last thing we want to do is do tests that have high false negative or high false positive results.